Well, we all know that cancer screenings are crucial, especially when early detection can save so many lives. But since the start of the pandemic more than a year and a half ago, 1 in 3 adults has skipped that recommended routine cancer screening. For more, let's welcome breast surgeon and medical director of the Breast Health Center at St. Joseph Medical Center, Dr. Suliat Nurudeen, and colon and rectal surgeon Ivane Chua. I'm happy to have you both here. Dr. Nurudeen, I want to start with you. What's the most important thing for us to know about breast cancer screenings?
Well, breast cancer screening is an extremely important tool. It allows for the early detection of breast cancer, which we know increases the survival for patients with a new breast cancer diagnosis. You can think of a screening tool as any other preventative measure that you use for your health. It's just a part of the conversation that you should be having with your healthcare provider to ensure that you know your risk and that you're on track for early detection for a breast cancer diagnosis.
Any general guidelines for women to follow?
Well, Elsa, that's where it gets a little bit complicated. There are many national organizations that have different recommendations when it comes to when a woman should begin their breast cancer screening. Now, all these guidelines have their own background data to support them, but I think what's most important is knowing your individual risk. And that means having a conversation with your healthcare provider to talk about your risk to determine when is the best time for you to start your screening and what that screening program should entail.
Dr. Chua, what should everyone know about colon cancer screenings?
It's important to know that colon cancer screening is now starting earlier at age 45 to 75. It's also important to know that if you have a personal history of colon polyps, colon cancer, a family history of colon polyps or colon cancer, or a history of inflammatory bowel disease like ulcerative colitis or Crohn's disease, sometimes we have to screen a little bit earlier. Colon cancer screenings are important because it can help find little polyps that can be precancerous and take them out before they turn into a more major problem like cancer. The earlier we find cancer, the more likely we can treat it easier.
And what do you say to people who are still concerned about COVID?
I would say that the time for screening is now. It's safe and effective. Here at St. Joseph's Medical Center, we do practice high standards of sterilization and cleanliness. We require all visitors, patients, and providers to wear masks and also the appropriate PPE.
Dr. Nurudeen, why are screenings so important?
While COVID has been a huge burden across the world for the past year and a half, it is so important for patients to get back to their screenings. Screenings provide us with an opportunity to find things at an early stage or even before they even get to the point of becoming a cancer. It changes the conversation between you and your provider about how we screen you in the future, and then also it can change the type of treatments that we're able to offer to patients when they have an early detected cancer. So it's very important to get patients back into their doctor's offices for screenings so that we can continue to change lives related to how people are surviving from cancer.
It's also important to know that if you have any signs or symptoms of cancer, that you should contact your doctor or your healthcare provider for further guidance.
I agree. It's very important for us to get everyone back on track with their screenings. We have several screening programs here at University of Maryland, St. Joseph's Medical Center, so please reach out to us. We're waiting for you.
Doctors, I want to thank you both for being here. Really appreciate that. And as a stay healthy reminder to take good care of yourself and start living your best life, remember that you can download your free Healthy Living for Cancer Prevention and Wellness Guide at umstjoseph.org/WMAR. We'll be right back with more Midday Maryland right after this. Stay tuned.